Disorders of the outer ear. There are disorders of the auricle in which portions of the entire auricle could be removed accidentally from an accident or surgery or cancer. There's also a genetic disorder called Microtia, where one or more of the ears are very small in size. Anotia, the auricle might be entirely absent. That's another genetic disorder. Their congenital malformations of the auricle are associated with Down syndrome. Here's an example of Microtia. So you see one or both ears is small in size. The treatment for this would be otoplasty or pinnoplasty to improve the appearance. So plastic surgery. Missing auricles in children, it's not advised to do this plastic surgery while the children are still growing. You would wait until the child is fully grown or the pinna is fully grown to do the surgery. In the meantime, you could use plastic auricles or just leave it. It doesn't necessarily affect the hearing. Anotia is the absent pinna, so you see no pinna was present. And again, same thing, you could do plastic surgery or use a prosthetic piece until the child is older. Atresia is when either the cartilaginous portion, the bony portion, or the entire external auditory canal never formed. It could occur in isolation or with other abnormalities. So this might have occurred in Treacher's College syndrome, which is a congenital disorder involving the facial bones, the cheek, and the lower jaw. The abnormalities are also in the middle ear, and surgical correction is difficult. Another form of atresia could be caused by trauma or burns, blood blisters, or frostbite. So you see over here you have no auricle, no ear canal, and the middle ear is also a bit malformed. Stenosis is a narrowing of the ear canal. You could do a surgical procedure to widen the passage, but that isn't necessary always because stenosis does not necessarily produce a hearing loss. But having narrow ear canals means that they're more likely to get clogged with wax and create a conductive problem. So the hearing loss is more directly related to the area and the amount of the occlusion. Collapsing ear canals could happen during an examination. So wearing heavy headsets could create an artificial conductive hearing loss, a collapsing of the ear canals, and blocking the opening of the ear canals. So, for example, an older adult, their ear canals are more flaccid, so putting a heavy headset on them would sort of pull their ear canals down and block their ear canal, and again create this false hearing loss. This could also happen with children wearing very heavy earphones. So insert earphones are recommended. Insert earphones always give you a better test. Sometimes we don't know why children put foreign bodies and things in their ears that could cause swelling and create a conductive hearing loss. The problem really gets bad is if the children put the piece not only in their outer portion of their external ear canal, but they push it towards that more bony portion, and then it gets stuck and it creates a problem and it needs to be removed by a doctor. External otitis is an infection of the skin in the ear canal. So external outside otitis would be ear infection. This is also known as swimmer's ear. It frequently develops in people who have had water trapped in their ears. They complain of itching or pain. It's an external ear infection, a bacterial infection of the skin in the ear canal. It could originate from earplugs, hearing aid molds, soap. The best to do is to clean the area and to put a topical antibiotic on it. You can't do hearing tests on people that have this because it's too painful. So you see here's an example of an ear canal with this infection of the skin. Myringitis is an inflammation of the tympanic membrane in response to a viral infection. This could get very dangerous. You don't want to have any sort of viral infections in your ear or anywhere close to your brain, because it could spread up to your brain. So this needs to be treated immediately. It produces fever, pain, and blood blisters. So some forms could cause bone destruction, and the spread of the infection up to the brain could be fatal. There are also growths in the ear canal. Tumors might be benign or malignant. Osteotomas are benign bony tumors. They don't present a problem unless they grow so big that they occlude the ear canal and create a conductive hearing loss. Ixotosis is when these growths come outward, and depending on the size, again, they might also require treatment. Earwax. Earwax is totally normal, but sometimes when ear canals are small or the wax glands are copious, excess wax may be produced, and this might block and cause a conductive hearing loss. This isn't always so. I mean, you could have a lot of wax and still hear just fine as long as there's a small opening to the ear canal, to the tympanic membrane. The wax won't necessarily create a conductive hearing loss. When you're using your Q-tips, be very careful. You know, it's not recommended to use Q-tips for your ears because natural cleaning takes place on its own, and you don't want to push that wax into the bony portion of the ear canal. Once it hits the bony portion, it needs to be, removed by a professional. If the wax stays in your ear for a long time, it could harden and become more difficult to remove. So like hardened wax would almost feel like getting a scab taken off your skin. It could hurt a little bit. So there's medicine to soften the wax before it gets removed. Ear candling, that's never a good idea. There's no data that supports the use of that. Perforation of the tympanic membrane. So let's say you're using your Q-tip and you're not paying attention and someone bangs your elbow and you put the Q-tip through your tympanic membrane. That's one way to perf your eardrum. And the other way would be if you had a real bad ear infection, otitis media, and a lot of fluid build up in your middle ear, and then that fluid push out into your tympanic membrane. Both hurt very much, so you'll know if you perf your tympanic membrane because it'll be very painful. So the amount of hearing loss produced by a perforated tympanic membrane depends on several variables, including the size and the place of the perforation. Like I said, they can be very painful. Traumatic perforations might alter the normal tissue. Sometimes they close on their own, but sometimes you need to have surgery to help close them up, depending on the size and the location of the perf. So here, this looks very painful to me. There's a big hole in that person's tympanic membrane. So surgical repair could be done. This would be a Myringoplasty, where a vein graft would be used. And the reason they would use a portion of your vein is because the elasticity in the skin of the vein is similar to the fibrous layer in that tympanic membrane. So either vein or muscle tissue for the same reason, because it's got that more tough, protective, fibrous muscle. And here's a picture of the skin graft on the tympanic membrane. In response to infections of the middle ear, sometimes the tympanic membrane might become thickened or scarred. This would be called tympanosclerosis. The thickening would interfere with the vibration of the tympanic membrane and may cause a hearing loss, but there's really nothing that you could do about this. So this would be scar tissue on your tympanic membrane. So if you had a perforation and it went to heal on its own, there might be scar tissue.